Antibodies are Y-shaped proteins that circulate around in the blood, and their normal job is as an immune response against invading bugs like bacteria or viruses, and those the Y-shaped bit sticks onto the bug and allows the immune system to target it for destruction, so it tells the immune system what's going wrong. Unfortunately, in autoimmune diseases like autoimmune thyroid diseases, antibodies get directed against tissues of your own body, and they can either mark out that your body's having an immune reaction to that tissue, so they provide a signal that can be measured in the blood that that response is going on in your body, or sometimes those antibodies can directly cause the autoimmune disease. In Graves' disease, there are antibodies against the thyroid stimulating hormone receptor, and by some quirk of nature, those antibodies actually stimulate the thyroid gland to make more thyroid hormones. And they do that because there's some structural similarity between the shape of the normal thyroid stimulating hormone and those antibodies that target the receptor. So if you like, the thyroid is fooled into thinking it needs to make more thyroid hormone, when in fact it's the antibodies just have the same shape as the hormone. In Graves' disease, the overactivity of the thyroid gland is directly caused by the antibodies that come in and stimulate the thyroid hormone stimulating receptor. And so if you're diagnosed of having thyroid overactivity, the next test you should have is a test for those thyroid stimulating antibodies, TSH receptor stimulating antibodies, because if those are in your blood, it means you have Graves' disease, and 80% of people with hypothyroidism, that will be the cause. So it's a nice, easy test to be ordered, and it tells you immediately what the cause of the hypothyroidism is. So over the course of treatment of your Graves' disease, those antibodies will generally decline with antithyroid drug treatment, and when the antibodies in the blood have disappeared, your doctor can take that as a safe signal to stop the antithyroid drug treatment, and that there's a reasonable chance your thyroid will remain controlled at that stage. So the antibodies in Graves' disease have a direct correlation to how the disease is going, and the higher the antibodies in general, the more aggressive or worse the disease is, and if you have just low levels of those antibodies, the easier it is that your disease will be able to be treated.